Welcome to Mission Evolution Radio Show with Gwilda Wiyaka, bringing together today's leading experts to uncover ever-deepening spiritual truths and the latest scientific developments in support of the evolution of humankind. For more information on Mission Evolution Radio with Gwilda Wiyaka, visit www.missionevolution.org. And now, here's the host of Mission Evolution, Miss Gwilda Wiyaka.
I don't know about you, but I love science fiction. Always have. Many of the things we used to read about in sci-fi have become reality. Now we're looking at AI playing an increasing role in healthcare. Are the heretofore fictional medbots about to become a reality? If they do, will it be an improvement or a recipe for disaster? Mission Evolution Radio TV show is coming to you around the world on the Exxon Broadcast Network, xzbn.net. With us this hour to examine medical AI, the state of the American healthcare system, and possible solutions to the situation is Dr. Robert Pearl. Dr. Pearl served as a CEO in Kaiser Permanente, where he led over 12,000 physicians, 50,000 staff, and was responsible for nationally recognized medical care of 12 million Kaiser Permanente members. He currently serves as a professor at the Stanford Medical and Business Schools. Dr. Pearl is the author of 2 books on healthcare, Mistreated and Uncaring. His website, robertpearlmd.com. Dr. Pearl, thanks so much for joining us on Mission Evolution.
My pleasure to be here. It's great to be back with you.
It is wonderful to see you again. As a medical doctor, what was your specialty?
I fixed children with cleft lip and cleft palate, trained in plastic surgery at Stanford, and did that as my focus for most of my entire medical career.
So how did you first become interested in AI?
I've been interested in technology my whole life. High school, on summers, I actually worked programming computers as a way to pay for my school. And I've been interested ever since. I've seen it as the solution in almost every industry to the challenges that exist when you're trying to simultaneously raise quality and lower costs. And of course, when I was the CEO in Kaiser Permanente, as you mentioned, I focused on that. We were one of the first organizations to implement the electronic health record as the means of being able to raise quality. And then, of course, as the AI industry has evolved since then, particularly with the introduction of generative AI, it's been clear to me that the problems we've been trying to solve in American medicine, the impossibility of affordability for so many individuals and a languishing quality, now we have a solution.
Well, it seems to me like it would appear our doctors have become increasingly stressed and overworked in our insurance-driven system. Is there any relief in sight with AI? Because it seems to me like, when I go to the doctor anymore, the appointments are shorter and shorter. The doctor is more stressed, and they tend to spend more time hunting for insurance codes than they do examining me.
You're absolutely right. And whenever, as a clinician, whenever I see a set of symptoms, you're describing some very problematic symptoms, the tremendous degree of burnout amongst clinicians, the shorter and shorter visits, and I often think of it as a skimping on care. I know doctors are the most motivated, dedicated, mission-driven individuals. So the question becomes, why? And when I look at this question, I looked at it a lot when I was CEO, and now looking at it continually as I try to change the healthcare trajectory for our entire nation. My conclusion is it's the introduction of chronic diseases, or the epidemic of chronic diseases. We've seen a doubling of obesity over the past 30 years. We've seen a tremendous rise in diabetes. Diabetes, number one cause of heart attacks and kidney failures. We're seeing hypertension go untreated. Think about it this way. You're a doctor. You see a patient for the first time. You diagnose diabetes. You now have to plan the next 120 visits, the rest of their life. You see the same person because they have right lower quadrant abdominal pain. You diagnose appendicitis, the appendix comes out, and you're all done. We've just added more and more onto the backs of clinicians. And what many listeners and viewers might not recognize is that it's these chronic diseases that account for at least 30 to 50% of heart attacks, strokes, kidney failures, cancers. Just imagine what healthcare would be like if 30 to 50% of these problems didn't happen. And that leads to the second question, which is that we've known about chronic diseases for a while, but why have we done so little to address them? We only control hypertension, the number one cause of strokes, 40% of strokes. We control it 60% of the time at best. And we only control diabetes less than half of the time. And my answer is it's not for lack of trying. It's two things. First, as you point out, lack of time. You just don't have the time. Second of all, we haven't had the financial incentives. We pay so much more to reverse a heart attack than to prevent it in the first place. And now we have a solution, a generative AI tool that can not only help patients to stay healthier and lower the cost of care, but by doing so, diminish the workload on the doctors. And now instead of seeing a patient every 15 minutes, they can see a patient 30 minutes, 40 minutes, whatever the patient needs, because generative AI will help them to take care of the patients who can do just as well at home as in the doctor's office.
Well, it seems like the only limitation to AI is the people inputting the information. So how close are we to having AI that has the information that doctors have carried in their heads traditionally forever?
We're basically there. I mean, if you go today to any of the sources, I'm talking about ChatGPT, Gemini, Claude, doesn't really matter which one, and you put in your medical information, it will give you a very reliable, not a fully completed approach to medical care, but very, very close. In fact, the studies show that it's as good as most clinicians, in fact, better than the majority. It scores in the top 10% of doctors on the national examinations, and it does so also with a lot of empathy. I think the big challenge is not going to be the technology. Yes, it's going to take a couple more years. And with the introduction of DeepSeek, we'll talk about that maybe later. I think it's, instead of being 5 years, as I've been talking in most of my podcasts and in my writing, I think it's going to probably be closer to 2 to 3 years. But something else has to change too. The thing that has to change is that we have to shift the way that we pay clinicians. Because the reality is, if 30 to 50% of heart attacks and strokes and kidney failures and cancer didn't happen, we would significantly cut into the income of the doctors and the hospitals providing that care. It's not that they want it to be bad. They just need to be protected against the financial losses that exist. And that's why I'm such a big believer of moving from what right now is a pay for volume. This is fee for service. The more you do, the more you get paid. Create a problem so that you get paid twice, once for the problem and once to fix the problem, as opposed to prevention. And prevention both of the chronic diseases in the first place, and then more effective management of them once they result. If we could get 90% excellent management, excellent outcomes relative to diabetes and hypertension and heart failure and asthma and an entire list of diseases, now we would have a situation where everyone can win. The insurer wins because the cost goes down. The employer wins because the cost goes down. The patient wins because the quality goes up and the cost comes down. And the clinician benefits. I like to think about it as a very inefficient system. Not that the people in it aren't working very hard. The system is what is broken. And I'm a big believer if we could change that and apply new technology, generative AI technology, we could once again be the leader in healthcare in the world.
Well, it seems like the technology has kind of gotten us in this pickle, okay? I mean, you can go to a doctor and have something that's very obvious to feel on your side or whatever, and if it doesn't show up on their test, it doesn't exist. They don't know what to do with it. It used to be a doctor had the knowledge and they'd palpate and they'd come up with some kind of a reasonable solution to what's going on. And anymore, they're just so rushed and they're so reliant on their tests that the person slides between the cracks. How do you see AI improving that?
You're describing a phenomenon which definitely exists today, but I give it two reasons. Number one, the technology that we've had has not been designed to empower the patient. It's been designed simply to help the clinician in clinical care, but equally and maybe more importantly, in terms of revenue generation, or the hospital in terms of revenue generation. We have operative robots that have yet to be shown to be better in terms of the clinical outcomes, in terms of life saved or complications avoided. But they're very profitable for the company that makes them. They're very profitable for the hospitals that buy them, for the clinicians who use them. We need to have the tools that are designed around the patient. In this case, I'll call it the consumer, the people who get the care.
So are you talking about this new AI system to be available to the patients versus just to the doctors?
Absolutely. That's definitely what I'm talking about. So let me give you an example. We mentioned earlier about the chronic diseases. So it's like blood pressure. I teach at the Stanford Graduate School of Business, and across the way from the business school is the engineering school. You can go there, and they have these wearable monitors, stick-on patches that can accurately diagnose blood pressure. Great start. So you come to me, I'm a clinician, I prescribe a medication to you for your hypertension, and you're wearing a monitor, a wearable monitor. It's the size of a Band-Aid. It's not visible to anyone else. And it's recording your blood pressure, let's say 3 times a day. At the end of the month, you have 100 readings, and 92 are normal, 8 are abnormal. How are you doing? Oh, I'm doing great. 92 are normal. No, I'm doing terribly. 8 are abnormal. You don't know. And I dare you to find me a single clinician who wants patients with hypertension, sending them 100 readings a month. We could, if a generative AI tool attached to that wearable device monitors you and uses first and second derivatives, it would say to you, you're not doing very well. And it would communicate that information at 1 month. What happens now? The doctor says, I'll see you in 3 to 4 months. You come back in 3 to 4 months, your blood pressure is still elevated. What do we say? White coat syndrome. No, we don't know what's going on. One way you improve your blood pressure at 1 month, one way it's going to be 8 months. And then if another adjustment, 8 more months. It's why blood pressure is not controlled. We have the drugs. We have the know-how. We have the dedicated clinicians. What we don't have is the tool for the patient. And the same is going to be true for all of the chronic diseases. We could tell you 3 days before you're going to be hospitalized with heart failure. And we could interact at that point and change the drugs, change the medications, provide the care that you need. But we don't have that monitoring tool. Now generative AI provides it.
Well, it's about time for us to take a station break. Dr. Pearl and I will return shortly, so don't go away. This is Mission Evolution, www.missionevolution.org. We're coming to you on the X-Zone Broadcast Network, xzbn.net.
Are you ready to dive into the mysteries of the unknown? Tune into the electrifying X-Zone radio TV show hosted by the one and only Rob McConnell.
I'm Rob McConnell, and get ready for a mind-bending journey through the unexplained phenomenon that surrounds us all. From UFO encounters to cryptids, ghosts, and everything in between, we've got it covered here in the X-Zone.
Rob McConnell, the seasoned investigator and renowned radio personality, brings you the most compelling interviews with top experts, authors, and experiencers from around the world. Each episode is an unforgettable exploration into the depths of the extraordinary.
That's right, X-Zone Nation. Join me every week as we open the door to the supernatural and explore the strange and amazing stories that will leave you questioning everything you thought you knew.
And it's not just radio anymore. With our groundbreaking TV show, you can now witness the sessions unfold right before your eyes. From chilling reenactments to captivating visuals, prepare yourself for a multimedia experience like never before.
With a legacy spanning over 2 decades, the X-Zone Radio and TV show with yours truly, Rob McConnell, is your ultimate source for mind-blowing entertainment and thought-provoking discussions. Join our growing community of truth seekers as we continue to unlock the world's mysteries.
So, why wait? Step into the X Zone and embark on a journey that will challenge your beliefs, ignite your curiosity, and keep you on the edge of your seat.
Remember, X-Zone Nation, the truth is out there, and it's waiting for you right here on the X-Zone Radio and TV show with yours truly, Rob McConnell. Don't miss a minute of the action.
Tune in now on your favorite radio station or visit xzoneradiotv.com to join the adventure. The X-Zone Radio TV show with Rob McConnell, where reality meets the unknown.
The X-Zone Radio TV show, unraveling the secrets of the universe, one episode at a time. For more information, visit www.xzoneradiotv.com.
Are you ready for a tale that will leave you on the edge of your seat? Get ready to dive into the gripping memoir by Bart Sibrel titled Moon Man. Bart Sibrel takes you on a heart-pounding journey, unmasking the truth behind America's famous Apollo missions. Prepare yourself for hair-raising encounters with agents from the U.S. government's top-secret agencies. In Moon Man, Sibrel fearlessly reveals his real-life espionage adventures, shining a light on one of the CIA's best-kept secrets. Brace yourself for shocking revelations, including Sibrel's discovery of privately recorded audio exposing an Apollo astronaut's chilling plot, a plot orchestrated by the CIA. That's right. As Sibrel unveils this groundbreaking evidence, it becomes clear that there is much more to the Apollo missions than meets the eye. Could it be that we've been deceived all along? Moon Man is a gripping page-turner that challenges everything you thought you knew. It's a mind-bending journey into the unknown, where the line between truth and fiction becomes blurred. Don't miss this opportunity to uncover the secrets hidden for decades. Let your curiosity guide you as you join Bart Sibrel on his quest to find the truth. Moon Man, available now at Sibrel.com. That's Sibrel.com. Prepare to have your beliefs shaken to the very core.
Where did it all go so very wrong? With us this hour discussing the current state of our medical system is Dr. Robert Pearl, the author of 2 books, Mistreated and Uncaring. Dr. Pearl, where do you think the current healthcare system went wrong?
The current healthcare system was structured for acute disease. You had appendicitis, you had pneumonia, you broke a bone, you went to a clinician, you got care, and you were done. That's the financial system. We mentioned it earlier, the fee-for-service. That's the structure, doctors working in individual offices. And that's the fact that there's no, I'll call it, systemic leader capable of making change to happen because it wasn't necessary. Then somewhere towards the year 2000, what we saw is this shift from acute disease to chronic disease, but we never evolved the healthcare system. And that's where I think that it went wrong. We needed at that point to make this shift from fee-for-service to a called capitation, prepayment to the doctors and the hospitals providing the care that incentivizes them for prevention and better control of chronic disease. We need a different technology, not the technology of the last century for diagnosis, but this century to empower patients to take care of chronic disease, problems that are there every single day. They don't come around periodically, and they never end once you have one, except in the rare circumstances. And we needed a structure that can bring together clinicians. When you have chronic diseases, you often have many of them. 60% of Americans have 2 or more, and you need coordination. The kinds of solutions that are necessary in the 21st century are different than the 20th century. And that's where we went wrong. And so in response to all this, what happened? Monopolization. The number of insurance companies shrunk. 5 companies control over half of the industry. We know that in the majority of communities, there is now consolidation so that a hospital can charge whatever it wants because the insurer has no choice but to offer it because there's no alternative in the local area. We saw the same thing happening with private equity, with specialization. It was a smart financial move. These companies have done relatively well. But from the standpoint of the patient, it's the opposite. We need integration, coordination, technology that empowers patients. We need a financial system that rewards people, keep people healthy, not just reversing disease when that occurs. And we have not made that evolution. And so we've seen progressive deterioration. The US spends twice as much per American on healthcare than any other country, and we're last amongst our peer nations. Actually, we're 40th in the world in quality.
I'm here to tell you. So, the insurance company's not going to be real happy with your plan here, are they? And that's where the money is. How do you expect to get around that?
Well, I think they will be very happy because, an insurer, if you think about how insurance came about, it's a statistical calculation of probability. If I'm going to insure your house, I look at the entire community, the neighbor, how many houses are there, how many do I expect are going to burn down, what's the average cost, and that's the premium that I charge across all the people who are there. If we could cap the cost of an insurance product, then the insurance company is going to be a lot happier because it has far less risk. And that's what capitation does. It transfers a lot of the accountability to the doctors and hospitals. Now, why would they want to take that? Because they can do a lot better. Rather than seeing patients, as we said, every 15 to 17 minutes, they'll now have the time to take care of patients because they'll keep a lot of people healthy who today become sick. And why would a patient want it? Because there's nothing more that a patient wants than to be healthy. I don't know a single person who would like to have a heart attack and have it reversed than avoiding it in the first place. This is a win-win-win. And you're an expert in the area of incentives. This is incentivizing the outcome we really want today and that we can achieve today. Unlike in the 20th century, we incentivized a different set of goals because the diseases that we faced were not the same as currently.
So what happened to our diseases? That's the other thing. When you brought that up, it's like we used to have a you break it, you fix it kind of thing, and there wasn't this chronic disease. Where did that enter? And if we hit it at the core, can't we change that?
Oh, we can definitely change it. The question is whether Congress will enact the legislation that's necessary. A major driver of that has been obesity. We've gone from 20% of Americans being obese in the 1990s to 44% today. Obesity accounts for 40% of cancers. It's the leading contributor to diabetes. We're seeing all of these problems, I think nutrition being the number one driver of that. But there are other issues. We have issues where people are isolated, and social media is contributing to that. And isolation alone may be the problem, or may simply be the fact that when you're isolated, you tend not to go out, you don't exercise, you don't eat well. What we're seeing go back to the food for a second, is that the foods are designed to have us consume more calories. What the food manufacturers have figured out is that they can get more calories into a serving. So by the time you realize you're full, you've now consumed more of their product. Now, for starving people, high caloric foods are important because they don't want to starve. But in a nation as wealthy as ours, we should be able to provide this care. And I'm a big believer that what Congress needs to do is to create a tax on the high sugar, high caloric, high fat processed foods that account for so much disease. I mean, think about it. If they cause the problem, why should we not make them pay for the treatment? And part of the treatment, I believe, is to use those dollars that we would obtain to fund healthier foods, fruits and vegetables for people who can't afford it. And this would be a much healthier nation. And by the way, higher productivity at work, fewer issues inside the families, because when people get sick, The drain is not just on the individual, but in the people who love them so dearly. We have a tremendous opportunity, and I'd say that's the number one driver of why chronic disease is now so massive in volume and so ubiquitous in distribution.
How about education? I mean, you go to the grocery store and you see a harassed mother with 3 kids in the cart throwing the garbage, quite frankly, into the cart and paying for it with food stamps. Now, this woman doesn't wants to take care of her kids. She's struggling to take care of her kids, you know, but she doesn't know. How can we address the lack of education around food? Because the system doesn't want us to know this. They want us to continue buying it.
Well, we've had a lot of educational programs, and my honest interpretation is that they haven't had a great impact. There's a new one, by the way, that the FDA just announced that it would be considering, which is that rather than putting the information on the back of the package in small print, it's now going to actually go on the front. And it's going to tell you very specifically how much sugar, how much fat, how much of the problematic foods, sodium, which is hypertension's a major contributor to hypertension, is there. And in bold colors, you'll be able to see whether the amount compared to the daily recommended amount by dietitians is small, medium, or large. And I'm hoping that even harried parents going by the aisle will see the big red sign sitting on the front of the package and decide to not pick it up and pick something else up, maybe further down the aisle. But of course, as you could well guess, the food industry is not happy about this recommendation, and they're likely to fight it. And we'll have to see what happens under the new presidential administration.
Have to see what happens, period, right? So why are so many people falling between the cracks in the current medical system?
Care is just too expensive. That in the end is the biggest problem that we have. We now spend over $14,000 per American on healthcare. I mean, think about that. Particularly if you're an individual, you now have to pay for it yourself. That means the first $20,000 or some number like that of your income is going to your healthcare. And as you well know, that's just beyond that of 50% of the American populace. And every year that the costs go higher, the solution that the payers could be the insurance companies, or they could be the businesses that buy the insurance. How do they respond? They don't have any choice. They just simply cut back. And what do the insurers do? They put in prior authorization requirements to try to restrict care. No one that I can find is making a real effort, a major effort, to lower the cost by keeping people healthy. And until we do that, today's problems are just going to be worse next year and the year after. And who knows, as you well know, today Congress is debating a variety of ways to be able to try to lower the cost of care. You have the so-called Doge with Elon Musk looking at opportunities to make these cutbacks. And if we're not going to cut back in Social Security or Medicare or defense, and I concur with all of that, then where's it going to come out of? It's going to have to come out of Medicaid and individuals who have insurance coverage. So we're likely to see major hits inside the healthcare industry as well. If we don't transform the way that we provide that medical care, if we don't move to capitation, prepayment for value,
that's what I wanted to ask you about.
In trouble, yeah.
Is what this system would look like. Does it mean that you kind of have like a membership that you pay and then you just go as needed versus having insurance?
Well, no, you would still have insurance. In fact, you'd have very good coverage. It wouldn't impact you in a negative way. In fact, it could actually lower significantly the out-of-pocket expenses you'd have to pay. But what you would do each year is you'd have to designate who's going to provide you medical care. And the clinical side would now have to integrate. By that, I mean primary care physicians and specialty physicians and hospitals coming together and saying that we're going to provide care to this particular community, hopefully be a couple of competing systems, and we'll take the responsibility for your medical outcomes and for the cost involved. And we're going to give you technology and training and other ways to help you stay healthier. And that's going to be our approach. So you would designate every year who's going to be providing your care. Maybe it's a primary care physician. Maybe it's going to be a group of doctors. Maybe it's going to be a health system. I think the details would have to be figured out on a community by community basis, because not every community, as you well know, is exactly the same. And that would be the shift that happens. And the people accepting, they would say, we have 50,000 people in our program and we get paid X amount of dollars per person. And then they would say, how can we best spend this money? Because, if we don't provide excellent quality, if we try to skimp on care, if we don't focus on prevention, if we don't better manage chronic disease, everyone's going to get hurt, but we're going to lose our income. We're going to lose our dollars because we've been already paid that amount of resources in order to provide all of that care. And immediately they're going to start changing the way. They're not going to start buying expensive technology, let's say, that doesn't add any value and raises costs. They're going to invest in the ways to keep people healthier. They're not going to see patients every 4 months for 15 minutes. They're going to want to see people more frequently, or at least communicate with them more frequently. And they're going to want to use the technology to figure out who's doing well and who's doing poorly, and see the people doing well more often and the people doing poorly. They don't need to come in and waste an entire day. This goes back to what you said earlier.
I'm sorry. It's time for another station break. Dr. Pearl and I will be right back to continue our discussion. So please stay right there. This is Mission Evolution, missionevolution.org.
So I was watching the X Zone TV channel last night when I was abducted by aliens, and they kept repeating to me over and over again, simultv.com, simultv.com.
What's simultv.com?
That's what I asked them. They had it written on the side of their UFO.
How do you spell that?
UFO.
No, I mean simultv.com.
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 Right. simultv.com.
Interesting that you were abducted by aliens in a simultv.com UFO last night.
Oh, yeah?
Yeah. Now that you mention it, I remember now last night I was awakened from a deep sleep. My great-grandmother was standing there. She said she'd come from the hereafter to tell me about simultv.com. She even spelled it out for me.
simultv.com, sonny boy.
simultv.com.
simultv.com, sonny boy.
Wow.
Yeah.
Guys, you'll never guess what my psychic guru just told me.
simultv.com.
Exactly. Are you guys psychic too?
Of course.
We all know about simultv.com. simultv.com.
NASA has confirmed that they have evidence of life beyond Earth.
This discovery is confirmed.
LSC, we've had visitors again. Yeah. Apparently worth mentioning.
I filmed 16 minutes on March 5th, 1994, 16 minutes of broad daylight UFO activity.
The other side, the spirit realm, is a parallel dimension which runs, which coexists with ours. And what spirits are doing is they're sending waves of frequency from that dimension to ours.
The government instituted the truth embargo. The government poured disinformation and misinformation into this field, encouraging hoaxes and any other foolishness. It created a truth vacuum that naturally was going to be filled with theories and assertions and other stuff.
The oil oligarchs and the banks and the people who are making decisions that are leading us down the wrong path.
They've undermined the research, intimidated and threatened witnesses. The government is responsible for the fact that the status of this issue is not resolved.
I'm Rob McConnell, host and executive producer of the X Zone radio show. Now we are set to bring the amazing world of the paranormal and the science of parapsychology to broadcast TV and online video with the development of X Zone TV. X Zone TV will now bring our loyal listeners and new viewers face to face with the most controversial, and well-known personalities in the field of the paranormal and the science of parapsychology. From scientists to theorists, astronauts to adventurers, celebrities, pundits, advocates, and naysayers, they'll all join our rapid-fire TV broadcast, interactive discussion, and debate. Interest in the paranormal and parapsychology has never been more intense, and it continues to grow. The truth is out there, so take a deep breath and join us as we step into the light. For more information about X Zone TV, please contact me, Rob McConnell, directly at these coordinates, Rob McConnell at xzonetv.com.
Tests. Are you glowing in the dark? This is Mission Evolution, missionevolution.org. With us discussing modern healthcare is Dr. Robert Pearl. His website, robertpearlmd.com. Dr. Pearl, have doctors become overly reliant on medical tests, and are the right tests being ordered?
I think they have been forced into, I'll say, ordering a battery of tests that if they had more time, they could make a different set of decisions. So I don't blame the clinicians for doing it. I think it's, again, another symptom of the underlying problem. If you don't have enough, say, number of minutes to be able to explore in enough detail the symptoms of patients happening, you can't narrow down the likely diagnosis. And so you have no choice but to order, again, a battery of tests, particularly ones like MRI and CT, that are likely to be able to point out when there's a significant problem relative to, let's say, a potential cancer or some other life-threatening type problem. So the answer is yes, they are doing it, but I don't think that problem is medical education, medical motivation. I think it's the fact that we've not, again, had the right system in place to allow them, to reward them when they do the right things for patients. I mean, just imagine if you have a broken way that you get paid more for doing the thing that doesn't make sense for the patient and less when you do the right thing. Imagine how tough it is to work in that system. And then you add on top of it pre-authorization and claims denial, which is designed to lower the cost, but all they're really doing is restricting the care. I mean, it's completely backwards and tumbling downhill. And I just think that there's a solution that we could put into place. Don't make any doubt about it. It's going to be difficult. There are going to be winners and losers. There's going to be a transition period. But if we don't do that, I can guarantee medicine is just going to become more expensive without having concomitant quality. And what we're going to see is greater frustration for doctors, for patients, for nurses, for everyone else in the healthcare system.
Is there any hope of getting some help from AI with all the battery of tests that are available and all of the weird symptoms, and no two people are really alike? Is there any hope of getting AI to be able to aid in the process of choosing what tests and interpreting them appropriately?
I love that question because it's so visionary that you're asking, because the answer is absolutely yes. And I think, again, what we have to do is stop thinking about AI in the old context, the way we used to think about healthcare, and start to seeing it in a new way. We need to separate what the doctor does for the patient, because only the doctor can do it, and what the patient can do for the patient themselves. So the answer is, number one, is we know that AI is very capable of coming up with diagnoses. And we have 400,000 patients who die annually in the United States for misdiagnoses. And I can't help but believe that a technology that's capable of being very accurate, it will be ever more accurate into the future, particularly, as I say, with this new model, this DeepSeek model, providing much more focused expertise. And so in that way, yes. But in addition to that, what it's able to do and again, I'm going to use a business term, which is going to be segment people. Think about 100 individuals, a third of whom are doing really great, a third of whom are doing okay, and a third of whom are doing poorly. How do we approach them today? We see them all on a calendar basis, 3 to 4 months. No, we want to see the people doing poorly more often and the people doing great. Why are we wasting their time? This is the kind of approach that technology, a generative AI tool, and wearable monitors, particularly if it has a telemedicine service back behind it for when a problem is identified. This is the kind of 21st century care, personalized medicine. That's what we want to be able to accomplish. And if we don't have the data and the information and the data analytic tools, the generative AI tool to tell us how we are doing, all we're going to do is make the life of the clinician worse. But if we have it, now we suddenly can change that. We can have 40-minute or hour visits with the people who need it the most because they're going to benefit. And for the people who are doing great, we can say, see you again in 6 months or a year or whenever the appropriate time period would be, just for a tune-up.
Well, the way it is now, I know of various people personally that have a very serious illness that are waiting months to be seen or to be tested, or it's kind of scary. It's gotten to that point. How is this going to help with that?
What you're describing is becoming the very common phenomenon, which is that the wait for care is growing longer and longer because the demand is just too great. It's not that clinicians aren't working hard. They're going faster and faster. They're running on that treadmill as quickly as they can. You described that earlier in terms of the visit you're having. There's just too many people and too many problems. So this is where, again, improving the health helps. If you can improve the health, fewer people need to come in. And by need to come in, not only are they healthier so they have to come in, but we also have the information so we know who doesn't have to come in. And that opens up space. Whether we want to use that space for longer visits for the people that we do see, or whether we want to use it to see people more frequently because their problems require it, or we want to provide more immediate access. When I was the CEO in Kaiser Permanente, we offered same-day, next-day appointments to 70% of patients with routine problems, 100% with the severe problems. That's remarkable. Why? Because in the end of the year, you end up seeing just as many people. But you need to be able to clear out the backlogs. If not, you just watch that wait list grow longer and longer. Technology can do that today. We did it with a lot of people and at an expense, but it was worth it for us because of how we were reimbursed through a capitated approach. But we now can do it for every American using technology, wearable devices, home monitoring, access to care. You can, rather than starting at the doctor's office, at home, you can provide all the information. You can interact with the technology. You can find your diagnosis. And by the way, a recent study coming out of Stanford and Harvard found that technology was 10% better than doctors at making the accurate diagnosis.
That's pretty impressive. And the one thing that occurs to me is who's more of an authority than the one that's been living in this thing for however many years, right? So if the patient has, they can look at different diagnoses and go, yeah, that doesn't feel quite right. Okay. But they have to have a certain amount of medical savvy to be able to reliably do that. How are you going to screen what the patients come up with as a diagnosis with the help of AI and the doctor and what they want to say?
This is why I think of generative AI as providing not just information and knowledge, but expertise. If you go to a search engine and you click on a link, you're going to get a lot of information. But unless you have the medical background, as you say, you're not going to be able to use it. We have this technology. It allows you to program a computer, by the way, about as good as the average programmer without having ever taken a course in information technology. It allows you to be able to paint a picture that looks like a Rembrandt, even though you never had an art course. This will allow you to come up with a very high reliability with the right diagnosis for the problem you have, to understand the evaluation that you need, and to look at the appropriate treatment. I often tell people about a podcast host. I was on a podcast, and the host said to me, she said, my husband fell skiing 3 months ago, slid about 100 feet down the hill with his arm over his head. His shoulder still is painful. It doesn't work well. What do you think is going on, Dr. Pearl? You're a skier. You're a doctor. I thought I knew what it was. I said, I'll tell you what. You said on this podcast you've never used a generative AI tool. Why don't you download the free ChatGPT? And by the way, I have no relationships with any of these companies. Why don't you download the free version, put your husband's information in and see what happens. And then call me back and I'll tell you my thoughts. 5 days later, she calls back. She says, thank you so much. We put all the information in place and said he most likely tore his rotator cuff. He needed to have an MRI to establish a diagnosis, and he needed to see an orthopedic surgeon because almost definitely he needed to have a procedure to repair the problem. And that's exactly what happened. We went to the doctor. He diagnosed probable torn rotator cuff. He ordered the MRI. He scheduled the surgery. And he said, if I had waited 3 more months, I probably could not have gotten the tendon back as the muscle would have contracted. Imagine how much power that is, how much expertise that is. The doctor didn't even have to explain what the MRI was or why it was getting done or why surgery was indicated. The patient understood it. This is the empowered patient. It's what I believe is going to be the future of medicine. It's no longer going to be just the clinician sitting in a hospital or an office. It's going to be an empowered patient at home, coordinating with a clinician or a group of clinicians in an office or in a telemedicine service or at a hospital. But this new milieu is going to allow us to make diagnoses more accurately, more rapidly, and as a result, keep people healthier at lower cost.
I love your vision. And here we are in one big modern mess medically. How are we going to get from this big modern mess where you're waiting 6 months when you're in the process of dying, thank you very little, to what you're envisioning? How are we gonna make that transition, and how long will it take?
Well, you're asking I don't want to say $1 million question. It's a $5 trillion question because that's how much we spend on healthcare today. Someone's going to have to lead it, and unfortunately, it's not going to be the patient because a single patient or even a small group of patients doesn't have enough power. I could envision it happening by the commercial purchasers, the people who provide care to 155 million Americans. I could imagine it coming out of the insurance companies, that they could decide to make this shift because they recognize that they are so frustrating patients and doctors alike with prior authorization and claims denial. I think it conceivably could come out of the government, but I don't have a lot of hope that the government's going to ever lead in an innovative entrepreneurial kind of way, which is what this is going to need. But I could imagine an employer saying to the insurers, look, 5 years from now, 3 years from now, we are only going to purchase products that have the following criteria. They've got to be paid on a capitated basis, and they've got to use modern technology, and they've got to achieve higher quality at lower cost. And if you do that, we're willing to fund you for the next 5 years so that you can make the investments that are going to be necessary. And if you don't, we're going to find someone else who will. I can imagine the same thing coming out of an insurance company, or I can imagine an insurance company doing a bunch of pilots, 10 pilots across the United States, different environments to make sure it works in all the different areas, and at least testing the hypothesis with groups of clinicians. And then if it works, putting it in more broadly. But as you know so well, right now, healthcare is pretty stagnant and it's pretty financially remunerative for a lot of the players. And so you may be right. We're going to actually have to have a crisis at some particular point and have the government be forced to take the lead. I can't tell you how it's going to happen. I can just tell you that in my writing and in my podcasts and coming on your terrific shows, I'm trying to get an enthusiasm amongst listeners. What we know is that when 30% of the population demands that something happens, that's when change occurs. When it's less than that, we can talk about it all we want. We don't see the positive outcomes that we all need, desire, and deserve.
So are you suggesting that you have insurance, but the insurance company then pays for the pay-per-view, if you will, and you just go in as needed?
Yes, that's what I'm suggesting. And rather than having deductibles that today are $5,000 and $7,000 that people can't afford, and they therefore often skimp on the care that they need, I'm saying that basically you'd go back to where we were before. Maybe there's a small cost out of pocket, far less than today. And the total cost would be dramatically less than today, which is why we could afford to put a system like that in place. Because as long as the cost of the employer is going up at double inflation, we're never going to see the patient burden be diminished.
It is time for yet another station break. Dr. Pearl and I will continue to explore the future of medicine. This is Mission Evolution, missionevolution.org.
NASA has confirmed that they have evidence of life beyond Earth.
This discovery is confirmed.
Well, let's see, we've had visitors again. And anything worth mentioning?
I filmed 16 minutes on March 5th, 1994, 16 minutes of broad daylight UFO activity.
The other side, the spirit realm, is a parallel dimension which runs, which coexists with ours. And what spirits are doing is they're sending waves of frequency from that dimension to ours.
The government instituted the truth embargo. The government poured disinformation and misinformation into this field, encouraging hoaxes and any other foolishness. It created a truth vacuum that naturally was going to be filled with theories and assertions and other stuff.
The oil oligarchs and the banks and the people who are making decisions that are leading us down the wrong path.
They've undermined the research, intimidated and threatened witnesses. The government is responsible for the fact that the status of this issue is not resolved.
I'm Rob McConnell, host and executive producer of the X-Zone radio show. Now we are set to bring the amazing world of the paranormal and the science of parapsychology to broadcast TV and online video with the development of X-Zone TV. X-Zone TV will now bring our loyal listeners and new viewers face to face with the most controversial and well-known personalities in the field of the paranormal and the science of parapsychology. From scientists to theorists, astronauts to adventurers, celebrities, pundits, advocates, and naysayers, they'll all join our rapid-fire TV broadcast, interactive discussion, and debate. Interest in the paranormal and parapsychology has never been more intense, and it continues to grow. The truth is out there, so take a deep breath and join us as we step into the light. For more information about X-Zone TV, please contact me, Rob McConnell, directly at these coordinates, Rob McConnell at xzonetv.com.
Is our current technology helping or hindering healthcare? This is Mission Evolution, missionevolution.org. We're continuing our discussion with Dr. Robert Pearl. His website, robertpearlmd.com. Dr. Pearl, people are, they go online and they try to figure out what's wrong with them, but it's kind of like a shot in the dark. There's the good, the bad, and the ugly information out there. Do you think currently, what are some of the current downfalls of AI and the internet in medicine?
Let me stay focused on AI because the internet, we could spend an entire show just talking about all the different facets that it has. I think the biggest problem is we're still in an evolution. This technology is 2 years old. It's a baby. It's a tiny baby in what it will grow into as an adult. If it doubles every year, it'll be 32 times more powerful in 5 years. That's like your car going as fast as an airplane 5 years from now. The introduction of DeepSeek, which is a distillation model of AI, is going to allow tools to be built far more rapidly at much lower costs. But where we are today is we don't yet have what I believe we need to have and will have, which is the demonstrated proof around the safety and reliability of this technology. Let me give you an example. If someone has a bunch of symptoms, they often will call a telemedicine company. They'll call an advice center, someone they're going to interact with using predominantly the telephone, but conceivably some type of telemedicine type solution. Now imagine if we create another device, one very specific to your diseases. You have diabetes, you have hypertension, you have heart failure, you have asthma. And now what we do is we let you call, we take 1,000 people, 10,000 people who are calling in, and we separate them into two groups. We test it. We see, how do the humans do against the technology? And now what we say is that we're not going to improve any new technology until it's 10% better on quality, comprehensiveness, on minimizing errors, at being able to provide the information with empathy. And now, once we have tools that accomplish that, that's where I now think we're going to see this leap going forward. So I think the biggest limitation right now is that we're just in the early phases and it's not yet ready. I'm going to encourage viewers and listeners, try it, experiment with it. Don't use the free versions. There are several of them out there right now. You don't have to pay for this approach, and learn, but still check the answers with your doctor. But get ready for the time when that's not going to be necessary. And I predict that time will be here sometime in the next 3 to 5 years.
So you've said this twice now, and I want you to tell me how AI can have empathy. That's kind of a human trait, isn't it?
Well, I'm reporting to you, by the way, what's happened. The University of Arizona did a study. They took communications. These were text messages from patients and doctors. They took the answers the doctors had sent, and they used the same text messages and gave it to an AI tool. And then they brought in doctors and nurses, independent observers, to evaluate all of them, not knowing who generated the information. The ones generated by the technology were 4 times more comprehensive and accurate and 9 times more empathetic. Now, why is that? Because empathy is really not about the person giving it, but the person receiving it. Do you feel heard? Do you feel like your pain is being responded to? Are you being given information that's going to help you in that process? And we can say that's an innate tool. I don't really know. You'd have to take a child, put them on a desert island and see whether they developed it on their own. But the ability to respond to it is definitely a learned skill. I have a dog. I love my dog a lot. And I remember a time when I was running and I got tripped up and I went to the ground. My dog comes over, he's licking my face. He has empathy. He doesn't know how to express it except by licking and being able to show attention. Empathy itself is I'll say a universal characteristic, but the ability to communicate it, that is the learned skill. And that's what the generative AI tools have figured out. They've read the literature. They've read all the novels out there about the particular subject. And I say read them, obviously not in a literal sense. And how to express that, how to help people. I mean, that's why you train to be a clinician. That's why you train to be in the social services world, because you learn how to meet the needs of the person feeling that pain. And that is what the technology has learned to do and does exceedingly well.
So I think all of us, I know all of us, have had the lovely experience of calling, for help. If you're calling Amazon, if you're calling whoever you're calling for help. And of course, AI answers. And you can be on the phone for 20 minutes and still not get where you need to go unless you just scream, I want to talk to an agent. I want to talk to an agent. I want to talk to an agent 16 times. That's not very effective. How are we going to get around that kind of an approach?
Well, I think what you're pointing out is our human tendency to want to talk to a person rather than a machine. And if that's the case, the AI tool isn't going to be particularly effective. My challenge with AI today is that most of the AI we have today is not generative AI. Most of it is what's called narrow AI, where the technology has been trained to do something, but from my perspective, it doesn't do it very well. And that's why, there's a gentleman named Turing, so-called Turing tests, that way back when asked the following questions: when will we have, I'll say, advanced computer technology? And he concluded that when, in a blind way, you're able to query a source and you don't know that whether it's a human or a machine, you can't separate them apart. And we haven't had that ability really until now. And that's why I'm so excited about generative AI, because this is a tool that I think has now addressed that problem and will be able to overcome it. So that opportunity to be able to help you, to give you the confidence, to give you the trust. We talk about this now in the AI world as an agent, that you could actually trust to do that. You could go to a travel agent if you're planning a trip. You can certainly try to do it yourself, or you could have a generative AI tool do it for you. And when the agenda that you have, when the cost is less, when the hotels are better, why would you want to rely on the human rather than the technology? And that's the day that I'm talking about in medicine. And again, I think for listeners, we're not there today, but I think we're going to be there very soon, 3 to 5 years. And so that's why I think that we're going to be willing to do that. When I don't like the generative AI, the AI tools that exist, because they never solve my problem. If I wanted to solve it the way they solve it, I could have done it myself on the website. I need a human being to make an exception to the rule. I needed a human being to do something different. And that's not possible. I'm hoping, I'm expecting that generative AI in all aspects of our life, but particularly in medicine, will be that tool to accomplish it. When right now it's the middle of the night, 11 p.m., and your child has 103 fever, you don't know what to do, it's going to give you an answer. When you have a chronic disease, you want to know how you're doing, but your appointment with the doctor's not for 4 months from now, it will give you an answer. When you're very afraid of symptoms, you want to know what's going on, what's the likely diagnosis, do I have cancer? You may not be able to answer the question because you need to have more testing and procedures, but it'll give you what you need when you need it. And that today is becoming an ever rarer and an ever more scarce commodity in medicine.
Our technicians, like you pointed out, are exhausted. Okay. And we're looking at more and more human error because of that, are we not?
Yes, absolutely. That's what we're talking about. What we know is that, as I said earlier, 400,000 people die every year from misdiagnoses because doctors are rushed. 400,000 have permanent disability because clinicians are rushed. There's 250,000 people who die from preventable medical errors because nurses are rushed. What we have is almost 500,000 people who die because we don't do a great job of controlling chronic disease because people are so rushed taking care of the acute problems, the complications from them. We're talking 500,000 to 1 million deaths that could be avoided. And one of the things I just want to say that I'm focusing on a lot more right now that we don't talk about is the pain. We talk about a person dying. We don't talk about the loved ones who now is missing a child, a spouse, a parent. We have to recognize that the pain that's being inflicted is not in our brains, it's in our hearts. And when we start to see that, I'm hoping that we're going to have the energy, we're going to have the commitment, we're going to be willing to take the risk, the chance in order to make and transform American healthcare for the betterment of all of our citizens.
Are we looking at AI having to program AI? It's getting pretty complex here.
It does it on its own, which is the really remarkable part, that actually we don't fully understand how it does it. We just feed it information, by which I mean off the internet, out of books. It's read every medical journal, it's read every medical book, but how does it learn? We don't really quite know. It creates a lot of its own rules, its own approaches. It finds things that it uses to better be able to predict what we need in response to our query. So in that sense, yes. And again, I've mentioned a couple of times DeepSeek, which is a distillation model, which means it's a generative AI tool that takes what currently exists, the ChatGPTs, the Claudes, the Gemini, and it's able to build on top of that. And in building on top of that, it's able to do it at a lower cost and far faster. So yes, this ability to learn is definitely intrinsic in the technology itself. And I'm optimistic that when it comes to medicine, we can continue to improve. What people may not realize is that when you're in a hospital, They're attached to all these monitors. They generated a terabyte of data. We're talking about 10 with 14 zeros. 97% of that we throw away. We never know. We don't learn anything from it. We have that opportunity. We do a research project. We're going to find a lot of data and information. It's available. It's inside a generative AI application. We have to now apply it. We can accelerate the pace of medical innovation, of medical technology, the improvements in clinical outcomes. And I think that we now have a tool. In the end, dedicated clinicians with empowered patients and generative AI will be 10 to 100 times more powerful than any of the three alone.
Well, in closing, I have to ask you, Dr. Pearl, what's your mission?
My mission is to make American medicine as good as I believe that it can be, and as good as I believe that it needs to be, to preserve the health of Americans, to make medicine in the United States the best in the world, or any nation that's going to embrace it, to become as good and as the best that exists. I want to diminish the inequities that exist in the healthcare we provide to people. I want to eliminate the frustrations and the pain and the loss. I think we can create a great American healthcare system, a great global healthcare system, if we apply the technology that we have and put it into the right context, the right way to reimburse the care, to organize the care, the collaboration, the cooperation, and the leadership required. And I'm hoping that we're going to do it sooner than later, because every year that we wait, there's another 500,000 people who suffer the consequences.
Well, Dr. Pearl, unfortunately, we are out of time. We could go on forever, but we are out. So please, thank you so much for coming on the show.
My privilege. Thank you so much for inviting me.
Our guest this hour has been Dr. Robert Pearl, a professor at Stanford Medical and Business Schools and the author of 2 books, Mistreated and Uncaring. To find out more about Dr. Pearl, where you can find his books and all he has to offer, visit his website, robertpearlmd.com. This has been Mission Evolution with Gwilda Wiyaka. For more information or to enjoy past archived episodes, visit www.missionevolution.org. But please be sure to join me right here next time. This mission will continue, bringing information, resources, and support to an evolving world.